Thanks for staying with us. A congenital heart defect is a problem with the structure of the heart that a child is born with. Some congenital heart defects in children are simple and don't need treatment. Others are more complex and may require multiple surgeries performed over a period of several years. The lack of facilities and specialists combined with enormous costs involved mean that only a small percentage of vulnerable children are getting the help they need. Learning about your child's congenital heart defect can help you better understand the condition. We're joined by Dr. Wilhelm Lichtenberg, who is known as the singing surgeon. Doc, a pleasure to have you on the program this afternoon. Now, your foundation, Young Hearts Africa, has achieved remarkable success with 26 life-saving operations in just 7 months. What inspired you to start this initiative, and how do you see its impact on the lives of vulnerable children with congenital heart disease?
Good afternoon, Shantla. Good afternoon to your listeners too. Thank you very much for the opportunity. Well, it all started when I was a junior trainee surgeon at Red Cross Children's Hospital in the early 2000s. And there was a young girl who didn't survive an operation because she got to the hospital too late because the system was just not geared in her favor, as it still isn't, and it's even worse now. And her mother's face when I went to tell the mother that her little girl had died was forever etched in my memory. And I walked with that idea in my head for a long time until the opportunity arose to start the foundation, which is a whole long story in itself. Sorry, there was a double-barreled question you fired at me there. I forget the second half. Forgive me.
So the prevalence of congenital heart disease in the country is quite staggering if you really think about it, with only a small percentage of affected children receiving this life-saving surgery. What are the main challenges, both in terms of facilities and costs, that also hinder more children from getting the necessary treatment?
So let me paint a picture for you briefly. We have a population of just over 60 million people. Only 15% of the population have medical insurance. The other 85% are completely dependent on a public healthcare system, which is on its knees and dysfunctional and cash-strapped. And we won't go into the reasons for that. And the World Health Organization has determined that to run an effective cardiac surgery program in a country, you need to be doing 460 operations per million of the population per year. In South Africa, in the public sector, we do 28, which is less than 6% of what the World Health Organization recommends. So, and the reason for that is we, A, don't have the facilities, and B, we don't have enough expertise. We don't have enough trained people to do this highly complex work.
So the link between socio-economic factors, such as the ones you've mentioned, and this congenital heart disease is quite alarming. How does Young Hearts Africa then address the disparities in access to healthcare, especially for children born in sub-Saharan Africa?
Well, it's a vast topic to discuss in such a short time. The way we've decided to do it is we have children all over the country on waiting lists to undergo these operations. And our pilot program runs at the Red Cross Children's Hospital in Cape Town. And what we do is we have allocated funds to the Children's Hospital Trust in order for them to create the space and theatre time and capacity to do extra surgery so that we can help whittle away at that waiting list, which is where we concentrate our efforts at the moment. But we are hoping in the coming year to expand that sphere of influence to other hospitals in the country which also have waiting lists, and that will be budget driven. But that's where we address the disparity. Obviously, if one wants to try and address the underlying cause, which is maternal health, that becomes a much bigger field. And what we're talking about at the moment here is congenital heart disease. We haven't even touched on rheumatic heart disease, which is also something which is preventable if one had adequate primary health care facilities. But that is something we're looking at getting involved in the future. At the moment, as I say, we started our program in November, so we literally just parked the blocks.
So the singing surgeon is quite a unique and captivating title. How has your passion for music played a role in indeed raising awareness and funds for Young Hearts Africa? And how did the collaboration with Queen Brian's May and the Soweto Gospel Choir come about?
Yeah, so I was at a congress recently where I presented the work we're doing, and I described how it came about in my title as being a little bit quirky and left field. When I was at school, I wanted to become an opera singer, not a doctor. My father convinced me otherwise, and he was right, of course. He said to me, you can practice medicine and sing in your spare time, but not the other way around. And when I decided, just for my own enjoyment, to take formal singing lessons, I was singing in a church, and a man who's now become a very dear friend came to me and he said, listen, I own a recording studio, I want you to come and record an album. And which was a realization of a lifelong dream. And I said to him, okay, fine, but because I've been so fortunate, I wanted to do something, I want to give something back. And that's where the idea of using music to tell the story and to raise the awareness was born. And when we started the foundation, as part of the launch of the foundation, to when the website went live and everything, I said to him, listen, we both love Queen's music, and one of my favorite songs of theirs is Who Wants to Live Forever, which Brian May wrote in the back of a car in 20 minutes, he tells me. And I said to Rian that that's the perfect metaphor for a legacy, isn't it? I mean, we can't live forever, none of us can, but we can build something which can be there when we leave to benefit others long after the fact. And Rian set about rearranging the song with a distinct African influence. And I said to him, look, if you don't ask the question, the answer is always no. So I took a chance, approached Brian May via his website and said to him, listen, this is the story, this is why we're doing it. Would you consider, for the sake of the cause, recording it with us? And after about 4 weeks, they contacted us and said, yes, Brian's interested, he wants to hear more, send us what you have. And he took one look at it and wrote back and said he thinks it's absolute genius. He'd be only too delighted to do it with us. And that's how it happened. So I take that as a sign. This whole project has just really had the wind from behind from the start. So we're very grateful and very fortunate.
Fascinating story. Thank you for your time. That's Dr. Wilhelm Lichtenberg for sharing the inspiring work of Young Hearts Africa and also shedding light on this critical issue of congenital heart disease in children.